All right, Jennifer, do you want to start us off? Do you want me to?
Why don't you start? If you're okay with starting, that'd be great.
Sure. So, let me introduce myself for those of you I don't know. I think I know most of you though. I'm Ellen Pentra. I am the full-time social worker in the Pediatric CF clinic in Chapel Hill. And we're gonna, as you saw on the invite on the flyer, we're gonna talk a little bit tonight about helping your child or children gain some independence in regards to CF care and just sort of health and self-care in general. I'm also going to talk just a little bit about school, since I know that's something that's come up for a lot of people. I'm going to go ahead and I'm going to share my screen with you all because I have just a couple of slides, just mostly to give people something to look at while we're talking. But let me go ahead and do that. Okay, oops. All right. So hopefully you can see just a beginning slide there. So like I said, we're just going to talk a little bit about helping your child be more independent in CF care and treatments with self-care in general. I am going to not go into detail about a lot of things. There's so much information. So I really encourage you, if you have questions or to ask those, or you can put them in the chat, or if there are other things after tonight to contact the care team that you work with, whether that's nurse or social worker. I know Amy's here, and we're both always happy to answer questions and talk through things with people. So I will move forward. So I really like this slide, and the idea that CF care really is self-care. So I think as we get older, we start to learn and understand that taking care of your health is an important part of what we generally call self-care. Self-care is so much more than a bubble bath or a massage or chocolate milk or whatever you really enjoy. It's a lot about investing in yourself, and so whatever that looks like. I really like this slide. It's or this picture. It's from the CF R.I.S.E program, which I will touch on just a little bit, again, because there's so much really good information in there. But I know some of the folks joining us tonight have younger children, and so you may not be familiar with CF R.I.S.E. So I'll touch on it just a little bit here. But one of the things I like about this image in particular is that it really kind of gives a visual to the partnership and the process of when your child is young. You are the one doing the caring, right? You're the one preparing meals, you're the one making sure medication is ready, and then as your child ages and gets into adulthood, those roles sort of they switch just a little bit. Your support and your presence is always needed and always helpful, and so your knowledge of where your child has come from. But you do step back just a little bit. The goal would be for your child to then be able to take on a lot. So I just think this is a nice visual. I wanted to share that with people. So what is CF R.I.S.E? So you may have heard of CF R.I.S.E. You may be just hearing about it now, but it's a program that aims to help those with CF and family members learn responsibility, independence, self-care, and education around CF and CF care. But it even goes further than that, to be talking about insurance and transition to adulthood. What does that look like going to college? And so there are some really neat modules and self-assessments that your child can look at. I actually, being relatively new to the CF world myself, started taking some of the self-assessments, then because they're not aimed to be overwhelming or challenging or punitive. And I know sometimes they can be. And so it's nice to have the opportunity to use them as a sort of stepping off point, a roadmap, or a way to begin a discussion about whether it's insurance or health. Airway clearance is a topic, diabetes is a topic that they cover. There's some really nice parts of it, and that usually starts around age 10 or so, and so taking families and the kiddos through different ages and stages, different milestones, helping think about ways that you can foster independence within your child. I have I think it's the next slide. So it kind of talks about the different ages, and some of the ways that you can begin to shift that care and that responsibility. And again, this is really just scratching the surface. There's so many really nice parts to it. But if you're interested, if you want to, I do have on my computer here, I forgot to include it as a slide. It was sort of an afterthought. An example of one of the self-assessments that you can do with your child. So prior to COVID, we had done a better job of incorporating the CF R.I.S.E into clinic visits and conversations, and really hoping to be able to incorporate that more going forward, because it's such a great tool that you can use in clinic, at home. There's an online component to it. Definitely be looking out for a little more information about that. Some of the team has been talking a little bit about kind of how we can get that more accessible, because there are some really, really nice pieces in there that can help, again, like I said, sort of start that conversation. For me, like I said, being new to CF, I did take some of the self-assessments, and it was really kind of neat to learn what I didn't know, and things I didn't even know I didn't know, that I could then sort of go to my team and ask questions and get more information. So I thought that was really, really, really neat. So let's see, move on to the next one. Yeah, so some of these strategies you may already be doing with your children, and these are, again, just sort of some general strategies, general ideas of helping at almost any age, helping your child sort of learn a little bit more about their own care. So you'll see that these are more specific to healthcare and CF care. But I think one of the important things is the second one is sort of sharing the process. As I was sort of putting this together, I was thinking about how maybe when you first got the diagnosis, when your child was first diagnosed, that the team probably spent a lot of time sharing information with you, right? And so you got a lot of information, you were taught a lot of new things, and we don't necessarily take that same time as children age. Some of it's sort of taken for granted. They've done this their whole lives. They know how to do this. And one of the nice things about CF R.I.S.E, again, going backwards, is taking that time to really have that conversation about what are the things that we do need to teach and how do we do that. But these are, again, so you can look through here, just sort of some different things at different ages or different stages that might be helpful, for your children to be gaining independence and sort of understanding, why is it important to do certain things. Maybe they don't understand it, and giving them space to ask questions. I think asking questions is one of the best ways to learn. One thing that I did want to kind of touch on a little bit, and you'll see the bullet point, meeting alone with their provider. So that's something that we think about, beginning around those teen years, allowing children to have the opportunity to meet one-on-one with their doctor, the dietitian, social work, and then kind of coming back together as a group to have a conversation, so that your child can get that practice of asking those questions and sort of getting an opportunity to hear information themselves and then sharing it, which can be really, really neat to be able to do. The other piece that I think is equally important down at the bottom, allowing your child some space to try things, right? So it may not be the way that you do it. It may not be the right way, right? But as long as health and safety are obviously the first priority, but being ready to kind of step in as they need help. And as that nice little graphic showed, your 6-year-old kiddo is going to need a little bit more support and a little bit more guidance than your 17 or 18-year-old kiddo. And so we want to be able to let them have the opportunity, whether it's at school or at home, to kind of try things out their way, to figure out what that looks like for them. All right, I just have a couple more here. I did say I would touch a little bit on school, because school is going to look really different for people this year. So there's a lot of different ways that people are thinking about school, and some schools are going to be all remote, and some are going to have a hybrid plan. So these were just some ideas about what you can do to help your child sort of gain some independence and take some responsibility for their school this year in particular, when they may not have that external structure around them. And it may be that you may have to work during the day, or even leave the house for work, right? So it's not everybody has the same ability to have that structure during the day. And so one thing that I think is super important is sort of creating a space just for learning. If you have that space in your house, whether it's a special a desk or a table, but a place that can be kind of just for learning, that can give your children the ownership of that area, right? So this is their school space, and give them the opportunity for that. Clear times for starting and stopping, just like we value clear times for starting and stopping work, or any other sort of commitment that we have. The clear times for school can be really important, especially if that is something that's happening at home. So again, that space and those times allows you and your child to step away and be able to enjoy other areas and other aspects of your time together. Checking in and having a chance to really ask what's going on for them. And if you get excited, and if you value this time, and you value their learning and their independence, they're going to get more willing to be excited about it as well. And so those are just a few kind of really simple ideas. Let's see, I think I just have a couple other ones. Oh, then, just something to be thinking about is that there are so many other forms of self-care, right? There's so many other ways that you do help your children learn independence. And I'm kind of curious, and maybe we can come back to this after. I know Jennifer has some really nice things that she wanted to share too. So I'm curious, what have people done to sort of start this conversation and start helping children, regardless of the age? You can start helping children learn independence from a very young age. And so just sort of thinking about what are the things that you've done, and how can you share that with your family? And of course, any other thoughts that people have. I kind of went through some of that quickly, so I'm more than happy to go back or answer questions if you want to let things marinate a little bit. I did say I was just going to kind of skim the surface, and so that's definitely what we have there. But again, feel free to reach out and talk to anybody on your care team to answer questions and have more conversation about it. So with that, I will stop sharing my screen and get to see everybody's lovely faces again. All right. So I don't know if people want to talk a little bit, ask questions, or if Jennifer, you had some really nice things that you wanted to share that you had. Oh, I think you're muted. There you go.
Does anyone have a question before we go on? We could ask. I'm flexible. This should be sort of a dialogue.
We have some other really good resources on the call. So Amy is the other social worker in the clinic, and Jennifer Leandro hi Jennifer, is one of our nurses and very well versed in CF R.I.S.E. And so the little bit of the scratching of the surface that I did, she might be able to share even more really great information. So if people do have questions, please put them in the chat or speak up.
Okay, before I go into I have slides too, but there are a couple things that you mentioned, Ellen, in yours that I just want to mention that made me think of other things that I want to mention before I forget. One of the things was that you said to set like daily, weekly, or monthly goals. And one thing that we did as a family, so our daughters are now older, but we also ended up homeschooling them. And so, we structured the day, but we would have a weekly meeting where we would just talk like I think that we did it on Saturdays or Sundays, just as a family, how did things go? And we did actually come up with a goal. Everyone would, I would come up with a goal, Timothy would come up with a goal, and the girls would each have a goal that they would work on. So then we would talk about how it went. So that was sort of just like an independent, you can do that with young children and have them start working on that. I think they were in elementary school at the time, and that did really help them, and we ended up growing with that. Then they could see too that we sometimes failed to meet our goals, which was good for them to see as well. So that was just one thing that I thought of. And then I think that's it. I'll just mention that for now. But there was a question that came up in the chat.
Yeah. Samantha has a great question. So beginning to swallow enzymes. That's a tough one. And I wish I had a really great answer, but I don't. And so, Jennifer has a Candyland game. That sounds like fun. That sounds like a really neat way kind of to take the pressure off a little bit.
So can you hear me?
Mm-hmm.
Mm-hmm. Okay, I was having difficulty with my camera, so I didn't know if I had difficulty with my volume.
No, you're great. Thank you so much for chiming in.
Yeah, sorry about that. Things worked out, so I joined the call late. But yes, in our clinic, we have a Candyland game. We work closely with the recreational therapists and our pharmacists, Cameron and Carissa. We can easily send out, I think it was Samantha that asked that. We can easily send out how to do that. A lot of the nurses, even with my own background, I was in surgery forever, and we had tons of transplant patients back then. And so we start with a nerd to start swallowing the nerd. Then you kind of progress up to like a Skittle or a Tic Tac. So it kind of has to be candy they're interested in. That's why the Candyland game is kind of an important thought, because you literally can put out the Candyland board, and then the treats you want them to have, you have to kind of acknowledge, yes, they might be ingesting a lot of candy right now or in this moment or in this time slot, but you progress with the candy. And the kids get really animated because they get so excited that they've swallowed like 2 nerds, 4 nerds, 6 nerds, and then they're progressing. I relate to this game really well because I am a grown woman, almost 50 years old, and I cannot swallow pills. And I have kidney issues, and this was the horror of my mother's existence with me as a small child, that I could not swallow any of my meds. And so I have very creative ways that I can help with that. So I really do promote this game. So we can easily, even though we're seeing some in clinic and some not right now, we're doing mostly virtual, but we can easily send out and talk with you, do a proximity call, and kind of show you how this works.
Thank you. That was
tired of buying applesauce. That's funny. Well, you can always try ketchup. We just need it to be acidic. So ketchup is always a good resource too if your child is a lover of ketchup. That's a good one. But also, the other thing to that too is, right now it's hard, with everything because we're all at home. But I will tell you, kids take meds better when they're at school or preschool or day school, or it doesn't have to be daycare, but they're with peer groups and they want to look cool no matter what age they are. And so it will impress you who they might take pills from better. And then it becomes easier for you with enzymes at home.
Great.
Yeah,
Thank you.
Jennifer. That's really, really helpful. That I learned a little something. So thank you.
It depends on the child too. I mean, we had one who wanted to learn how to swallow pills and one had no interest. So it can be challenging. But I'm going to share my slides and I'll just go through them quickly because we definitely we have young parents of young children and then a couple of older ones, which I think is just my husband and myself. So let me share this. Okay. So I just wrote the thing to promote. Oh, did this go? Okay. One of the things that we found, and this is just from my experience as a parent, and then I do work as a school psychologist, but these are things really that we did that we found to be so helpful that now our kids are older and actually now they're living at home going to college. But so we actually are, you know, it's interesting to watch them do things on their own and we've really taken a back seat. And they do their treatments and what they're supposed to do, but just creating a routine really helped that become a habit. And Timothy, jump in here if you have anything that you want to add. But we used to, you know, like and you probably, parents already probably do these things anyway, but just we created a routine and had things that were going on, like had them pick to watch a TV or play a game, read books during treatments, minimizing interruptions.
Sorry, I don't mean to interrupt, but I think that people are having a little trouble seeing. Can you put it on?
Oh, sure.
The slideshow.
Is it not on?
Well, we just sort of see the outline. If you can click it so that it's full screen.
Okay, let me try.
I think if you click the little I don't even know how to describe it. The little icon at the bottom next to where you zoom in and out, it goes into full screen mode, the presentation.
Okay, let's see. I'm trying to find it. The icon on
your PowerPoint.
Okay. I might have to, Timothy, can you come up here and help me? I don't know how to do this. Hold on.
That's all right.
That's okay. Trying to. Here he is.
There's a start slideshow.
I know, he does PowerPoint all the time. Okay.
Oh, it's up there.
Oh, it's at the top. Okay.
Space bar.
Okay. Can you see that now? Okay, great. Thank you.
Up, down.
Okay. So we used to have them pick activities to do during their vests, and then later, so it became a habit. And then as they got older, we did develop a list of things that they could do with us when they did their vest, and then things that they would be doing by themselves when they did their vest to try to promote that, because, you know, they often wanted us to, you know, if they enjoyed that time because it became a habit, but then they always wanted us to be there, which sometimes we couldn't be. So we wanted them to be able to be more independent with doing their treatments. So we ended up coming up with 2 lists that they would pick from. And then, so by giving them choices, like the lists gave them choices, and it promoted independence because they had some control, but we're giving them the choices. So the choices were both options that were satisfactory to us, but they were having some power to make the choice. And then, let's see, I don't know okay. Choice give kids practice at making little and big decisions. So, you know, these aren't major decisions that they're making, but they're getting practice and gaining confidence as they, you know, gain some control over the situation and see that the choice, you know, that it worked out. And then it's also a great way to diffuse independence when kids are younger, as they have a choice. So maybe they can decide that maybe one of those choices would be a good one. I know that was an issue for us with our kids, and I have down at the bottom. So, and then they learn problem solving skills because they start thinking, they get used to the choices. And then, you know, we had some experts in coming up with, if you give them A, B, or C, then they might say, well, what about this or what about that? But it ends up being that that's good, because then they're thinking of things that they want to do. And as long as it's appropriate or whatever, you know, we could end up, they could move on, and we didn't need to be so structured with it. But it helped us a lot because we had 2 that needed to do their treatments, and they didn't always want to do them on the same days. So anyway, I'm going to keep going. And then just like, we'll just do the little childhoods, the early childhood, but just an example, like, would you like juice or water to take your enzymes, or, the candy that Jennifer suggested? And then, would you like to buckle your vest on, or would you like me to help you? These were things that we had to just get kind of creative sometimes. And then, getting them to be more involved in the process. Like, do you think it'd be better to do your vest before dinner or after? Starting to give them a little leeway. And then, do you want to sterilize your equipment all at once, at the end of the day, or after each treatment? Just giving them some, and that was like just teaching them as they got older. And then later, what time of day are you going to fit in, like helping them plan out their day. But then, they're in charge of it, but you're helping them sort of process it. Exactly what Ellen was saying. And this isn't really relevant, but just, having them prepare to, if they have like cross-country practice or something, just what they need to bring with them when you're trying to get them. So you can kind of scaffold it and help them through the process, like Ellen said in her presentation. So, and then I just wrote preparing for clinic visits. This was kind of important for us too, just having the kids become a little more involved and as they got older, asking questions. But with you, I'll just go quickly through this because most of you have younger children, but discussing with them what we're going to talk about with the doctor, what are some problems, and then writing, if anything had come up between clinic visits that we should discuss. And then we ended up having them start to complete their background medication health forms and they really didn't like this because they'd seen us do it for a long time, but it actually taught them that, oh, I need to know what medications I take, what are they for? They needed like insurance information. So it taught them sort of what they needed to have on their own. And then we could help them, have a little list of medications for their wallet and things like that. But it helped them realize what they needed without us having to tell them to do that. And then these are just opportunities that help them form habits of, being able to give as much information as it helps. Their medical care depends on their self-reporting of what's going on. So it just helps.
You can put that stuff away, Teresa, if you want, if you have stuff to do.
He doesn't know he's not muted, but that's okay. So I think, you're giving them an opportunity to gain skills and confidence and just helping them navigate. So when they're adults, they can do it. And then developmental suggestions, which are not by any means set in stone, but just trying like what we tried to do. But these are all older. So I think I'm just going to skip it, but it'll be available on the website because I don't think anyone has any children this age. I can go through it really quickly, but I might just skip it. And then if you want me to come back to it, I can. It was just suggestions of how to promote independence with them understanding their CF, being able to communicate about that, and then, but a lot of this is in CF R.I.S.E, so I'm just going to skip that. And then just these are some resources that I consulted putting this together. So I'm going to stop sharing and then see if anyone had any questions, but those are just my things from our perspective, but our kids are older, so.
No, I love that. I think those are great.
Oh. So I guess at this time does anyone have any other questions? Okay, I switched to the presentation mode. I don't know if anyone's having any, how your kids are with their treatments, or if anything, I guess the enzymes was an issue. Do you want me to go through the slides? Okay. Older, okay, I'll go through it. So my age guidelines might not exactly be the same as with what Ellen had, but this is just, oh no, I have to, okay, he showed me how to do this. There we go. And I need to go back. There we go. So I don't know how to move my, okay, there we go. So by age 12, we wanted the girls to sort of be able to explain their CF and to be able to, so we would talk to them about it. I mean, there are resources that the clinic gave about about CF, and I don't know, I'm sure that those still exist, but just books that were developmentally appropriate for kids. And we just had them repeat back, general information about their CF, like why do they have to take enzymes, nothing too, not extremely detailed, but we wanted them to be able to explain that they had CF and what that meant for them. And then, let's see, we would encourage again, like what Ellen said, have them spend time with a medical professional without us in the room. So we did that, I guess, a lot when they would have PFTs, they would go with I would stay back and they would just go with the person to their PFTs. And that was sort of a practice. And then they would talk about what they'd done. I mean, we didn't do this initially, but they ended up doing that. And so that was, and then it grew from there, I guess. But that was the first thing I think that they did sort of by themselves with a medical professional, was the PFTs. And then, learning the medications that they take and what each one is for. And also if there are any allergies that they have, that was really important to know. And then who to contact for medical equipment. Clearly that wouldn't be something that would be in their head, but I made a list so that even, mostly was in charge of that when they were younger, not my husband. And so I made a list of what medications came from like which specialty pharmacy. And then I just put that on the inside of our kitchen cabinet. So it was posted, and even the girls could see it, if they needed to, but it was just posted. And that, I think that made me feel more, because Ellen was talking about self-care. Like I didn't feel like all the responsibility was on me. It was out there and someone could read that if they needed to. And then, so that was helpful for refills too. So trying to teach the girls to do their refills, which still is sometimes not done exactly the way I would do it, but that's okay. So does anyone have a question? So that was just by age 12. And then in the next years about that, just having them like do those health history forms that I mentioned before, like learning when were their hospitalizations, if they had any, and then just other family members' health history, knowing how to contact doctors. We typed that up too, just a list of, their CF clinic doctor, and then the after hours number, and then the pediatrician, or, the ENT, whatever doctors they saw. We just had that typed up for them. And then we also for their wallet too. And then teaching them how to fill a prescription or how to refill one. So this is something that I think we could have done more of at an earlier age, but they can start learning about it, and they can certainly be there when you're refilling it, and they can see how it's done. And then just having a current list of medications or doses in the wallet. There are different forms that you can use, I think, possibly in the town hall that was recently held with a couple weeks ago at UNC. I think this came up a little bit, and if not, we can come up with a form, but there are all kinds of lists where you can just write down the medications that then, if they're looking at that health form and it says what medications do you take, and they have like a little 1-inch spot, and there's no way you can fit all the information there. I would have the girls write C attached and then tell the person at the desk, I have a list, and they would just make a copy of that. Of course, during COVID, I don't know, I guess you'd put the list in a baggie and then you could wipe that off with a wipe. I'm not really sure. But that was helpful, so that they knew that they had to carry that with them. And then by age 17, just having them select an adult doctor. I'm not talking about the CF doctor, but the primary care doctor. We had our older daughter do this and sort of sit down and look at the, well, what does your insurance cover, and who are the people at the practice, and helped her. She made her own appointment and she went herself, and I didn't go with her. And then just helping them form decisions, how did it go, and learning to self-advocate and communicate, and is it a good match, is it not? And we had obviously discussed this with them earlier, but that was something that I think it's good for them to know how to do that. And let's see, have access to your teen, should know how to access their medical record. I know it's through my chart for UNC and a lot of systems. I think there are a couple different systems that they use, so it's certainly a lot easier than it used to be. but how to access information or who to contact if that was needed. And then knowing the health insurance information, we requested extra cards for the girls as they got older. And then to understand if a referral was needed, these are things they need to know later on. And you know, what is even a referral, talking about this. And then knowing the limits of health insurance and helping them plan ahead for when your teen is an adult and no longer on your plan, which we haven't gotten there yet, but you know, it is definitely something to consider later on, and they need to understand that. But I don't know if I had to, let's see if I can leave that up and bring my screen back up. So does anyone have any questions about that? I went through it kind of quickly, but those are just, you know, not, they are, I did use a resource for that, but I also just integrated things that we did. And that just, you know, my perception. So I think that was, does anyone have?
I love the idea of what you were talking about printing up, whether it was medication lists or contact information, and sticking that on the inside of your cupboard. You know, that's something useful for everybody, right? Or a babysitter,
Yes,
a family member coming in addition to helping your girls learn who do they call if some, you know, X, Y, or Z. If it's this, you know, medication, or you can write, you know, dosages or those kinds of things. I know a lot of people like to see those things, right? And so that's something that we can help with in the clinic. You mentioned, Jennifer, the pharmacists shared in the town hall about the app for.
Yes, that's what it was. It was an app.
And so if anyone on the call tonight is interested in that, ask your pharmacist when you have your next visit, or get in touch, because I think they're really excited to share that with people. It was really neat to learn about. So hopefully it's something that works for people, and they can help you. If I understood it correctly, if anybody else understands this differently, please jump in and correct me. But I think they can help you input all of the medications initially, so that might not be so overwhelming if there are a lot of medications.
Right, I think that's right, because one of my daughters has the app, and it didn't seem like it was challenging to put in the information. In fact, it may even have been transferred by, I think Cameron might have done it for her. I'm not sure.
That's awesome.
But,
That's great.
But so I'll speak to the app just a little bit, and actually the worksheets for that. I was actually met with Cameron and Carissa today. This is going to be a project we're going to try to fluidly get out to pretty much everyone, especially right now with just uncertainty about, you know, everyone kind of being at home. Like, what can we help in creating the more prominent, independent CF patient when parents are working and they're maybe not being as supervised. So the app, the reason we have the pharmacist initiate it to you, because it's kind of like an invite. And then it's kind of swooped in, whether you have an Android or an iPhone. The great thing about it is it not just lists the technical brand name of the medication, it shows you a picture of it. So the flip version of that for our younger kids, and this is something that we really, the pharmacist and I are very passionate about, is our younger patients not saying, I take a purple pill. You know, let them know, I take Prilosec, or, you know, I take 4 of these pills when I eat. Well, or is that Zenpath? Is that Creon? So what the sheets do that our pharmacists print off for you, it's basically a daily checklist or a plan of care that you can start with your little age people. And it shows a picture of it. It shows you like a sun or a moon, so they understand, is this a morning med or is this an evening med? But if it has any issues with food, it's listed. You know, like some meds that we tell families, like, you know, avoid dairy, or sunlight, it's going to cause sunburn. So they're very, very detailed. And we have actually a great med app from the School of Pharmacy that Cameron actually lectures in quite a lot. So we feel kind of privileged that this is kind of rolling out, especially for our younger age kids. So that's why, Ellen, as you said, they're really kind of giddy about it, because there's several tons out there you can kind of work with medication-wise. that these are like really savvy, because some of our meds are so specialized. It's kind of hard to describe what a PariNeb cup may look like, or, you know, an inhaler or a device. And they're pretty spot on for recognition for, you know, a 3-year-old, 4-year-old, not just a 14 or 16-year-old in high school heading to college. So it's really good. So definitely take advantage of reaching out to one of your nurses, or if you communicate directly with your pharmacist for either version, and we can kind of roll that out to you guys.
That's great. One of the other things we did for the babysitter was literally write down the order in which medications were supposed to be taken, which would be another thing that if kids are by themselves, or, you know, if someone else is with them, you know, while you're going to work, it's important to know. I mean, or just have it written down, because they might forget something, or, you know, I don't know. That was helpful too, just having that written out to give to someone, or have it posted again so it could be looked at. So I don't know if
those
anything.
visual things can be really helpful. And then, you know, like you said, they can be useful to a lot of people, but the visual reminder is something that you see regularly, something that you come in contact with frequently. And then it gets ingrained more and more. I love those things.
Does anyone have any other questions? We do have the more poll questions that we need to give again, but I also am interested in knowing what you'd want to hear about for future topics. One of the topics we thought we'd have was actually having, well, I don't know. I just would be interested in knowing what you're interested in. If anyone has, you can put it in the chat, or just feel free to jump in. Or if you think of it afterwards, you could let Ellen know, because we're always looking for ideas.
Yeah, please do. I mean, and, you know, send me information that you'd love to learn about, different topics or questions that you have that you'd like answered. I think it'd be great.
I had a question. When Ellen was talking about school, I was wondering about this as far as just helping the kids, what to say when other classmates or whomever, or friends or family or whatever, are asking about their meds or about their treatments, or, you know, what's CF. How do you guide your child about that?
How do you help them kind of answer those questions? Yeah, I think that's a really good question, and I hope other people will kind of jump in here too. But I think just like anything that sort of is unique to any child or any adult, you know, you want to be able to talk about what it is, and why it's important, how it helps you be healthy. It's not negative, it's not bad, it's just, it's a unique part of each person.
I think it depends on the child too. I mean, I think ours used to say we need this to digest our food. They didn't want to go into the whole explanation about CF necessarily, but they just said, I need these, and, you know, I don't know. That's
I had a conversation with one of our families just this week, and actually what they shared, I hope it's okay if I share what they said, but they talked about how each member of the family requires different things for their body. So whether it's one member of the family can't have dairy, right, at all. So that's something that their body needs or doesn't need. Another member of the family needs to take enzymes before they eat, because that's something their body needs. Another member of the family needs to eat a lot of extra protein. That's something that their body needs, and how each person in the family has different needs for their bodies, just to keep them healthy and safe.
I also think too, as you guys have been talking about so my child's older, but talking about taking ownership for their illness, or whatever we want to call it. And I think, you know, when they get older, if they know why they're taking it 2, 3, 4, 5, 6, 7, 8, 9, it's easier for them to explain themselves to their peers. And it's not something they want to hide, per se.
I think too sometimes that as adults, we kind of overthink it a little bit, and we want to offer a lot of explanation. We want to share the details, but a lot of times kids are really satisfied with the answer of it helped, like Jennifer, like you said, your girls might say, it helps me digest my, pretty straightforward, to the point.
Okay.
And I think a lot of times that really just answers the question just as much as they need, as much as they have.
Well, from a nursing perspective, I think it's really important and I try to empower my patients and family members to be like honest and open about what's wrong with them. It's really interesting, from family to family. Some families want to call it cystic fibrosis. Some families just want to say CF. Some people just don't want to call it anything. They kind of, I have a coughing issue. But the older they get, I kind of really encourage them to not be embarrassed to really cough and cough really hard, because we'd rather you cough, get it out, move on, than to kind of muffle a cough all day. Or meds, it's kind of like what Nicole said. The older they get, if they've understood why they're taking it, because the older their peer group gets around them, they kind of get nosy and they're like, hey, what are you doing? Why are you special? And if they want to claim they're special to take meds at school, that's great. But I also know boys that are playing soccer are not going to do an inhaler in front of their soccer team in 7th grade. They'd rather do it in the car when mom dropped them off, or sometimes they even go into the bathroom of the school to do it, because that's awkward. Middle school's awkward, and everything about CF in middle school's awkward. But then they get to high school and they're like, you know what? I'm kind of doing okay. And if I need to do a treatment, or if I need to speak up, or I need to take meds, they just do it. And either they are typical teenagers in high school that are like, so why are you looking at me like that? Or they kind of say, I have to take this med today. But I've had really good conversations with my high schoolers on, I'm glad I feel confident in why I take these meds and can openly speak to my care providers, and how I feel about my disease process. And I feel like they also tend to do better when they're kind of aware of why we're asking you to do, an hour and a half worth of treatments before school starts and an hour and a half of treatments after homework and AP classes and football practice in the evening. But it's kind of like one of the girls that didn't want to speak because she was shy at the town hall, but she is a really good role model, high school student in Charlotte, where she's like, I'm doing this for me. And I found field hockey, and I'm thriving in field hockey because I have figured out my routine. And my mom and dad kind of watch me do my routine because I feel good doing my routine. So I think it is important.
Yeah, the knowledge is power. Knowledge of being able to understand it for yourself and share that with other people.
Yeah, absolutely. I guess I have one more question about school. Hearing from some of the folks, in particular with the sort of younger elementary age school and the COVID impact, like you mentioned, with regard to, it can be challenging, certainly doing this at home. How is that going, and what has worked for you all to make that happen? Like Ellen, you mentioned setting up a specific space and establishing times. Is that enough? I know we had challenges, particularly with our older daughter, transitioning to school from like home to school, because it's the same exact, place, but yet now you're in school mode. So I was just curious how that's going for other folks. If it is going for other folks.
It might not have started yet.
Yeah, true. Summertime.
It's one of the conversations that I had with a lot of people sort of at the beginning of COVID, when schools were originally going online. It was that exact challenge of, you know, my child does really well in school and they really enjoy school. And they have a hard time. You know, this is a conversation that I had with one of our families, and the child, many children actually, you know, home is different. And so really creating that space was helpful for them to get into school mode, because once they were at home, well, they're supposed to do home things, right? You watch TV, you talk to your friends, you hang out. And so it was difficult to make that transition. Yeah. Samantha, I think you're not alone in that in that comment of you weren't born to be a teacher. I've heard that from a lot of families. Mm-hmm. And being okay with the struggle, right? This is hard for a lot of people, and it's okay.
Yeah. I don't know. We homeschooled, you know, for a long time, but we did it for health reasons because our younger daughter had just such a bad, I mean, our older daughter had such a terrible year in kindergarten and had just had health problems. You know, she always had them as an infant all along. So it didn't work well for her to be in school. And so we ended up just homeschooling. And then the first year was challenging, but but more because she, I mean, it wasn't the whole year, but just transitioning into the idea that she was going to be home when her cousins were at school was hard. But I don't know. I think the routine helps, like everything else. Just it really does help to have a routine. Once they were older and used to being in the habit of, you know, being at home, they could set their own routine. Again, it was helping them be more independent with their schooling. Okay, they wanted to do math in the morning, even though I hadn't planned that. Well, we would try it and see if it worked. And but we would discuss these things at our weekly meeting. And that helped a lot. It helped me because, you know, I wasn't the only one, you know, we weren't angry at the time, you know, we were just sort of discussing how things went, and it diffused that process. So yeah, every day. I'm sure it'll
1 minute at a time.
Yep.
Mm-hmm. Mm-hmm.
Yep.
You know, you make plans and you do the best you can.
Right.
You improvise.
Yep.
Mm-hmm.
Yeah. Sometimes it was a struggle to find, like, you know, I really like how you're moving in the direction of your vest. You know, like trying to find something positive that really was, you know, when you're just, you know. So
That's good. That's great. Those little kernels of
yep.
reinforcement. Yeah, that's good.
So anyway, but thank you for all attending. I guess, should we have I don't know, does anyone else have any other questions? You can put the other questions into the chat, or the poll rather.
All right. Do you want me to pull up the?
I don't know if does anyone have any other questions or anything that they want for future? That'd be helpful.
Yeah, please think about those things. There's so many great things that come out of discussion that might be really useful
Right.
for the future.
Mm-hmm. I do think the CF R.I.S.E helps teach them a lot of those information about their disease, though, which I think is really good.
Sorry, I just got excited. That may be a topic that we can go into in more detail,
right.
Or talk more about. And like I said, we do want to incorporate it more into the clinic, and did a little bit better job at that pre-COVID, wanting to help people make that maybe a part of their routine. But it's very cool. It's very neat. For those of you that don't know it, like I said before, I'm still learning about it, and I feel like it's taught me a lot, teaching me things that I didn't even know that I didn't know, and learning a lot. And it's a kind of almost a fun way to do it, because it's kind of light and easy to get involved in. So that may be a topic that people might be interested in.
Mm-hmm.
That's a great.
Okay. Let me write that down. So a program about the health well, care forward.
Scholarships.
Okay. Yeah.
These are some really great ideas, Samantha. Thanks.
Thank you very much.
And I'll just say that, you know, if you have a question, someone else has the same question. So definitely, you know, throw it out there.
Mm-hmm.
Just like in school, they tell you to ask a question. Somebody else probably has the same question. And I think that's probably true in most aspects of life.
Mm-hmm. Thank you. So August. So our next meeting will probably be in October. We'll have to look at a date, but we'll let you know. And maybe we could we'll get the information out as soon as possible. I think it'd be okay to put the polls up, or the first question up, Ellen.
Do the first one.
Uh-huh.
Let's see. All right. And again, these are anonymous. So whatever your response is, you know, people won't know it's you if you want to keep that to yourself. Okay. I don't know if everybody's had a chance to look at that one, but I can go ahead and do the second one.
Okay. Yeah, the first one's going to be the same.
Right. Right. Did everyone have a chance to take a look at that? Okay, I'll go ahead and put up the last one. All right, last one.
Yep. Okay.
All right. Thank you.
Great. Thanks. Okay. Well, thank you for coming.
It was really nice to be able to see everyone.
Thank you.
Bye. Take care.